Assalamu alaikum friends, welcome to my channel. Today our topic is urinary tract infection. A urinary tract infection is an infection involving any part of the urinary system. The urinary system helps in removing wastage and extra water from our body. It includes two kidneys, two ureters, the bladder and the urethra. The urinary system is divided into the upper urinary tract, the kidneys and the ureters, and the lower urinary tract, the urethra and the bladder. Infections that occur in the upper urinary tract mostly affect the kidney. This type is known as pyelonephritis. Most infections occur in the lower urinary tract. Infection that affect the urethra is called urethritis, and one that affects the bladder is termed cystitis. Now we talk about its risk factors. People of all age and sex can develop an infection. However, infections are more common in women than in men. People with diabetes and spinal cord injury are at high risk of getting infection. The following factors can increase your chance of getting an infection. Number 1. Poor personal hygiene. Number 2. Pregnancy. Number 3. Sexual intercourse with multiple or new partners. Number 4. Kidney stones. Number 5. Menopause. Number 6. A certain type of contraceptives. Number 7. Urinary tract abnormalities. Number 8. People who urinate with the aid of a urinary catheter are at high risk. Number 9. A recent urinary procedure. Number 10. Suppressed immune system. Number 11. Use of tampons and spermicides. Causes: urinary tract infection are commonly caused by a bacteria. The bacteria can enter into the urinary tract through the urethra and multiply in the bladder, where they grow and cause an infection. A large percentage of infection is caused by a bacteria, which is called Escherichia coli. Signs and symptoms. The signs and symptoms may depend on the part of urinary tract infected. The signs and symptoms of the lower urinary tract infection may include: Number 1. Inflammation and irritation of urethral lining. Number 2. Pain or burning sensation during urination. Number 3. Bad smelling or bloody urine. Number 4. Strong and frequent urge to urinate. Number 5. Lower abdominal pain. Number 6. Passing frequent small amount of urine. Number 7. Pelvic pain in women. The signs and symptoms of upper urinary tract infection may include: Number 1. Nausea and vomiting. Number 2. Fairly high fever. Number 3. Pain in the back or side. Diagnosis. Diagnosis will be made after the information has been given about symptoms, medical history including surgical history and medications. A physical examination and lab test completes the evaluation. Your doctor may take your urine sample for lab analysis to check the bacteria. You may be required to wash the area around your genital before providing such sample. This is to prevent bacteria around the genital from contaminating the sample. This process is called urinary analysis. In rare cases, an imaging test may be used to detect the underlying cause of infection in the urinary tract. This is only necessary in cases of recurrent infection. An ultrasound examination is done to check problems with the kidney and bladder. A CT scan also gives a detailed image of urinary tract. Treatment. A urinary tract infection is commonly treated with antibiotics. The type of antibiotics and duration of treatment depend on the symptoms of individual. Your doctor will choose the appropriate medication for your condition. Drinking lots of fluids to aid frequent urination can be helpful in flushing out the bacteria. I hope you will like my video. Thank you so much. Allah Hafiz.